For this video tutorial, we're going to talk about the Prepatella bursa, which is a bursa just on top of the knee here. So I'm just going to orientate to where this would sit. So this is the knee joint and this is the patella tendon over the top. And we're looking at the Prepatella bursa, which is a bursa that just sits on top of here, sometimes referred to as housemaid's knee. It can be inflamed either by trauma or from repeated pressure onto the front of the knee. You'll oftentimes come in with quite an obvious inflammation and thickening at the front of the knee joint. And we're just going to talk a little bit about the tips and tricks to actually scanning this. So first of all, just to orientate, so if I come a little bit distally, okay, we've got the distal aspect of the patella bone, that's the bright white area here, hyperechoic area of the bone. This is the patella tendon here. Okay, if I move more proximally over the top of the patella, so we can see here, the patella then becomes very superficial on our image. And if I keep coming more proximally, we're actually now coming onto the quadriceps tendon. So here we can see the really nice different layers of the quadriceps tendon as they're attaching onto the proximal aspect of the patella. So the purposes of what we're looking at here, we're going to sit right on top of the patella itself, okay? And the prepatella bursa will sit literally on the top of the bone here, so it will be in this layer, okay? And the reason that I'm putting the additional bit of gel, so you can see a dark area at the top of the screen, we make something called gel standoff. And the reason why we make the gel standoff is because even just the very light weight of the probe can actually push the fluid out of the prepatella bursa and leave us with a false negative. So when we're assessing for a prepatella bursa, my tip would be to always make sure that you create a layer of gel standoff so that you can be sure that you're putting no pressure onto the prepatella bursa at all, and that way you are most likely to be able to see if there is any fluid or inflammation in this layer of the tissue.